Good afternoon and welcome. This webinar is a collaboration between the U.S. Department of Veteran Affairs, VA Center for Faith-Based and Neighborhood Partnerships, CFBNP, and the Veterans Health Administration Office of Mental Health and Suicide Prevention, Education and Training Office. My name is True Lester Pauling. I am the Senior Outreach Specialist in CFBNP. I will be your moderator this afternoon. Everyone's phone has been muted. If you have a question during the presentation today, please type it in the Q&A box on the right of your screen. I will read the questions out loud at the end of the presentation, and the presenter will provide a response. This presentation is not available after this webinar, but a handout is available with all the resources Mrs. Mells will talk about today. This is a live recording. I would like to thank Ms. Lillie Mells for this collaboration. We are grateful for your time today. But before we get started, I would like to introduce Mr. Conrad Washington, Director of the VA Center for Faith-Based and Neighborhood Partnerships. Mr. Washington serves as the Director for the VA Center for Faith-Based and Neighborhood Partnerships and is a retired combat Marine with 20 years of active duty service. He is a licensed minister actively serving in his faith. He received his Master's of Divinity in Pastoral Studies from Moody Theological Seminary, his master's degree in Business Management, and a Bachelor of Science degree in Education. Additionally, he is a graduate of VA's class of 2017 Virtual Expiring Leaders Program. Mr. Washington?
Thank you, True. I appreciate it. Look, I'm glad that you all joined us today. This is a very important topic across the nation. And I'm so glad that we once again have our very own Lillie Mells, who's detailed to the office. Lillie, you keep hearing it from me publicly and privately. We appreciate you and we thank you for what you do as a colleague in the VA. I want to share a couple of things with you. We have one more day before the PAC Act deadline for your benefits to be retroactive from last year. That's one more day, but even after that, you still can submit for the PAC Act. So please get your claim in, right? Don't let that slip by. Today, we're going to talk about suicide prevention, share much information, and another topic that I want to share with you is called anti-Semitism, because across the nation it's growing and it's threatening the safety and security of many Jewish people. This kind of hate has surfaced so much that the president has established a working group to counter anti-Semitism and other forms of discrimination and bias. This hate is being exposed by extremist groups, individuals from online, and even those who are in person. We must be able to bring people together from all backgrounds, all faith, all ethnicities, in order to serve our veterans, their families, caregivers, and beneficiaries. That is what we do here in the VA, and we're so excited that you join us today, and we look forward to you receiving the information that's helpful as you go out into the different neighborhoods and communities. So thank you and be blessed.
Thank you, Mr. Washington. At this time, I would like to introduce Ms. Lillie Mells, who will be providing today's presentation. Please read a summary of her bio to the left of the screen. Ms. Mells is a licensed clinical social worker with over 20 years of experience. She has worked in various capacities to include child abuse, domestic violence, and substance abuse. Lillie is an Air Force veteran and has served as Director of Psychological Health for the Virginia Air National Guard. She has been with the Department of Veteran Affairs since 2013, working in suicide prevention. Currently, she is the Education and Training Program Coordinator at the Office of Mental Health, Suicide Prevention at the VA Center Office. At this time, I give you our presenter for today, Ms. Lillie Mells, for today's presentation. Lillie?
Thank you, Ms. Pauling, and thank you, Mr. Washington, for having me here to brief this very important topic. I'm excited to give this information to you all on the line. And so I want to go ahead and get started. First, I do want to turn off my video. I'm having a little bit of connection problems. And then once we get to the Q&A, I'll turn it back on. So the first thing I'd like to ask you all is, how many of you have actually served in the military? So I want to see what branch of service you served in. So go ahead and drop in the chat box if you're Army. Drop it in the Q&A box. So let's see who we got. Anybody? We got Army, Navy. What about just Navy? Anybody just from the Navy? What about our Marines? Anyone from the Marines? I know we got at least 2 in the house from the Marines. What about my brothers and sisters in blue? Anybody from the Air Force? What about the Coast Guard? What about the Guard and the Reserves? And I'm not sure if we got any veterans yet from our newest Space Force. They're still young, but we appreciate all. And the reason I like to know who's on the line is because, once you serve with each branch of the service, you have a different level of appreciation for what everybody brings to the table. And so I deployed alongside each branch. And so I have a very special appreciation for all those different branches of the service and what they bring to the table. So I say thank you to all of you. Now I'm going to go ahead and get started. And one of the things I like to ask first is that if you have any difficulty with this topic, suicide prevention can be very difficult. So just know that you can take a break, you can step out, take a breather. We're not going to go over any gory details or anything like that. But if you need to take a break, please do so. We also have the Veterans Crisis Line, which is now 988, or the Suicide Prevention Lifeline, which is also 988. It's actually the same number. The only difference is that for veterans or active duty, if you press number 1, you're going to get connected to the Veterans Crisis Line and a VA responder. If you just hold on the line for civilian responder, you'll get a civilian responder. So this is what we're going to cover today: our facts about veteran suicide, common myths about veteran suicide, and our VA S.A.V.E steps. So S.A.V.E is really our what we call gateway training, entry-level suicide prevention training. So that's what the VA has chosen to use is S.A.V.E. And then I'm going to go over some resources at the end. So by participating in this training, you're going to have a general understanding of the scope of suicide within the U.S., how to identify someone who may be at risk for suicide. So you can use this training for veterans, not only veterans, but civilians as well, and know what to do when you do identify someone at risk for suicide. So my next question to you all is, what is your biggest questions around suicide and talking to people in crisis? You can drop it in the chat box or you can hold on to that thought. But what are your biggest questions around suicide and talking to people in crisis? And hopefully by the time we get through this training, I would have answered that question for you. So now let's start with our facts about suicide. So suicide is a national public health problem. As far as the VA concerned, it is a national crisis. The numbers keep growing each day, not only among veterans, but also among civilians. And so it's a national issue. The rates continue to rise in the general population. And for every death by suicide, there's at least 135 individuals that are impacted. And I would venture to say that there may be even more. When you think about that one individual and how many people they come in contact with on a regular basis, if they're a person who works, depending on how many agencies and organizations they work with, their family members, their friends, their neighbors, they go into the grocery stores, coffee houses. There's many people that they come in contact with. And so there can be much more than 135, but at least the minimum is 135. And suicide is a complex issue with no single cause. If we knew a single cause, these numbers would not be where they're at today. So it's often the result of a complex interaction of risk and protective factors that are individual, community, and societal levels. So when we talk about risk factors, these are those challenges, those obstacles, those things that get in the way and hinders people's progress. They increase the likelihood of suicidal behavior. Protective factors are those buffers, those tools, those skills that we can use to help offset risk factors. So what we really need to have is a decrease in risk factors and an increase in protective factors, because that's what's going to help the individual. So we have to maximize the protective factors while minimizing risk factors at all levels throughout communities nationwide. So that's our goal. So when we talk about risk factors and protective factors, there's so many of each. Here's a list that we have. It's not an all-inclusive list, but these are some of the more prominent ones that we see over time. And so, as I said, this is not a complete list. It's not exhaustive, but we could add many more. But for these purposes, we're just going to talk about the ones that we have there right now. So on the risk factor side, prior suicide attempt. So someone who's engaged in suicidal behavior and has actually had an attempt, it puts them at a greater risk for suicide than someone who has not engaged in that behavior. Doesn't necessarily mean that that person will go on to die by suicide, but they are at greater risk than someone who has not engaged in that behavior. Next, mental health issues. So when we talk about mental health issues, we're talking about depression, we're talking about anxiety, we're talking about schizophrenia, we're talking about bipolar disorder, we're talking about post-traumatic distress disorder. So when we talk about these things, if they're not being treated, it definitely puts that individual at risk for suicide when you have untreated mental health issues. Okay, there's a greater possibility of suicide than someone who's actually engaged in treatment. Substance abuse. So when we talk about substance abuse, definitely when you're using a mood-altering substance, alcohol, drugs, anything that's going to alter your mood is definitely going to alter your judgment as well. And so when you have those competing factors, it definitely poses a risk, and that risk for suicide. Next, access to lethal means. So when we talk about access to lethal means, this could be medications, it could be different types of weapons, but for this purpose, we're talking about firearms. Firearms is the #1 method that's being used. And so what the VA has done is we have increased our education and knowledge of lethal means and lethal means safety. We have educated not only the veteran, the providers, and their family members. And I'll talk a little bit more about lethal means in just a moment. But it is a risk factor when you have access to lethal means. Next, recent loss. So when we have a recent loss, many times it poses a lot of stress and anxiety for individuals, and it is a risk factor for suicide. So when you're dealing with recent loss. And recent loss can mean many things. It could be loss of job, it could be loss of loved one. Okay, it could be loss of a limb. So there's lots of loss in there that is a risk for suicide. Next, legal or financial issues or challenges. So when we talk about legal or financial challenges, let's start with legal. When you have legal challenges, especially when you're the possibility of facing jail time, when someone is posed with those kind of things, it can be very devastating. And for many, just the thought of going to jail could definitely put you at risk for suicide. And then financial challenges, when we talk about going bankrupt and foreclosing your home and all those kinds of things, it definitely puts you at a risk for suicide. Next, relationship issues. And I must tell you, relationship issues, this is a really, really big one on the list. I'm not sure if any of you have seen the news recently, but there have been a lot of murder-suicides that are going on in terms of domestic violence. And when we have failed relationships, many times they can appear as if you're going through the grieving process of a death. And people go through the same emotions, shame, guilt, denial, anger, all of this. And so it definitely puts someone at risk for suicide. Definitely puts you at risk for suicide. Next, unemployment. So when you're unemployed, you're unable to take care of yourself, unable to take care of your family members. It may even lead to homelessness, which is next on the list as well. And so it's definitely a risk factor for suicide. So when you have a combination of these things, so you may have someone that's dealing with several of these risk factors. And so it puts them at a greater risk than someone who's not dealing with these type of issues. Now on the other side of the coin, we're looking at protective factors. Remember what I said about protective factors. These are those tools, those skills, those buffers. These are the things that you can do to offset those challenges. So access to mental health care. So if you're suffering from depression and anxiety and PTSD and bipolar disorder, if you're actively in treatment, you will have, these are protective factors, and you're less likely to be at risk for suicide if you're actively involved in treatment. Sense of connectiveness. So when we talk about sense of connectiveness, think about the time, especially for you veterans on the line, think about the time when you were serving behind those gates. You know, there was a sense of connectiveness there. When we talk about, you know, the unit that you belong to, you know, every unit has a number. Some units have call signs, you know, and your own chants and those kinds of things. And so it's just being part of that group. The other thing about being connected is that when you join the service, there's a mission. Each branch of the service has a mission. Each unit has a mission, and you know what that mission is, and you don't even have to explain it. Everybody in your unit knows what that mission is. And so for a lot of folks, when they leave the military, that sense of connectiveness is no longer there. You know, they kind of lose that connectiveness. So it's always a plus to have that sense of connectiveness. And so for a lot of people, we're still doing things and working with the military. That's how we stay connected, working at the VA, giving back to those veterans and families that are in need, just staying connected. Next, problem-solving skills. Now, I will tell you this. If many of us learned these skills at an early age, we would be so much in a better place in life right now. And I will tell you, I grew up on the streets of New York City, and we didn't have a whole lot of problem-solving skills. And so I have at least one fellow New York on the line, Will, and he knows what kind of problem-solving skills we use. Anybody in the audience can tell me what kind of problem-solving skills you think we used in New York? Just drop it in the chat box. Let me see what you're thinking. Okay. Just what do you think the problem-solving skills were? Okay, I'll give it to you. So growing up, we didn't use problem-solving skills. We used our fist. And so basically what we did was fought. And I will tell you, you know, it's not a good way to problem solve, really. You can't just fight your way through life. And some people fought physically and now they fight verbally, but you really can't fight your way through life. And you really have to learn how to problem solve and navigate through tough situations. And once you learn how to problem solve, you can deal with challenging situations a little bit better, you know, than someone who doesn't have those skills. Next, mission or sense of spirituality. Sorry, sense of spirituality. So sense of spirituality is very individualized. Some people practice formal religion. Some people go to houses of worship. Some people actually meditate, read the Bible. It depends on what works for that individual. It's not a one fits all. It's what works for that individual. So sense of spirituality. And so, and if it's not something that works for you, then it doesn't have to be on this list of protective factors, but it may work for some that are out there. Next, mission or purpose. So that goes back to part of that connectiveness. When you leave the military, you have to have a sense of purpose and some sort of mission in what you're doing with your life. And so when we don't have that together, you know, it kind of leaves us empty. And so you want to make sure that you have a mission or purpose in some capacity, whether it's giving back to your community, giving back to the military, doing something, volunteering, staying connected in some way. Next on the list is physical health. And I will tell you all out there, I see people every day walking around in pain, and you really don't need to. All of those ailments and injuries and illnesses that you have that you never took care of, you need to take care of them. And I will tell you, when I served in a uniform, I had no pain. Well, I take that back. I did have pain. I just ignored it, so I didn't feel it. And then once I left the military, I had aches and pain I never even knew existed. And it's because we're so used to pushing through. You don't have to push through like that. And I will tell you, it's better to go ahead and get those things taken care of. Just imagine walking around in excruciating pain every single day. You know, you don't want to do that. So when you're taking care of your physical needs, it puts you in a better position than those that are not. Next, employment. Employment is always a good thing. You know, you can take care of yourself, you can take care of your family, you know, you have a place to live, you know, food on the table. It's always positive, you know. The flip side of that is think about someone who's unemployed. You know, you can't feed your family. Imagine going home and telling your kids you can't provide anything to eat tonight. Or during the holidays, if you celebrate things like Christmas and you can't buy your kids gifts. It's a very tough thing to deal with. So when you're gainfully employed, it's always a positive. And then social and emotional well-being. You definitely want to be connected with things that are positive socially and good for you emotionally. Okay. Next, I'm going to talk about some of the key findings of the 2022 National Veteran Suicide Prevention Annual Report. So each year, the VA does an annual report, and we kind of look at some of the statistics from the 2 years before, just to get an insight of what the numbers look like. So here's the veteran deaths from 2001 to 2020. So if you look at this chart, you can see right there that there was a dip. So we actually had a decrease of about 399 in 2020 of suicides. But I will tell you this is not a number that we can celebrate, because as far as I'm concerned, 6,000 is still way too many deaths, way too many deaths. So until we get down to single digits of zero, we cannot celebrate this small percentage of 399. You know, it's just not a big enough number, at least in my book, that we can celebrate. But it is a little downward trend, but not enough. Next, look at the veteran suicide by age and sex. So we can see here, ages 18 to 34, that's the highest rate. 35 to 54, 31%, 55 to 74, 27%. But look at the 75 and older. That number is higher than the 35 to 54. So I can tell you that our older veterans are dealing with a lot, and they're starting to use suicide as well. Okay, now let's talk about the suicide deaths, methods involved, and the difference from 2001 to 2020. So remember, as I told you earlier, you know, lethal means. So when we talk about lethal means, we're talking about firearms, we're talking about poisoning, we're talking about suffocation, and then there's some other category. It could be, you know, ramming your vehicle into a fixed object, it could be leaping from a height, so forth and so on. But when we look at firearms, look at the numbers for firearms. In 2020, 71% of veterans use firearms. 50% of non-veteran adults use firearms as a method of suicide. Look at our non-veteran men, it was 55%. Veteran men, 72%. Non-veteran women, 33%. But look at the number of veteran women, 48%. That was an increase of 11%. Okay. And all of the categories in veterans were increased. Okay. And when you look at the other methods, poisoning and suffocation, they don't even come close to firearms. They don't even come close in any category. So this is why the VA has had to do more in terms of education about firearm safety, firearm storage. Okay. So lethal means safety. What does lethal mean safety? So in the context of suicide prevention, its safe storage of lethal means is any action that builds time and space between a suicidal impulse and the ability to harm oneself. So that's a mouthful. So let me repeat that. So in the context of suicide prevention, safe storage or lethal means safety is any action that builds in time and space between a suicidal impulse and the ability to harm oneself. So that's the goal. When somebody has a thought, we want to build in time and space between that thought and action. That's what we need to do. And so effective lethal means safety education and counseling is collaborative, veteran-centered, and it respects the important role that firearms and medications play in a veteran's life. And it's consistent with their values and their priorities. So one thing that the VA has done is, in the past, if someone was suicidal, and they had a weapon, and we knew that they had a weapon, the first thing that would happen is that the authorities would be called, the weapon would be confiscated, that person would never get that weapon again. And what we found by doing that is that people were less honest about owning a weapon or having a weapon or access to a weapon. And so what we had to do is go back to the drawing board and say, what could we do? What can we do differently to get people to own up to that they have a weapon and to get them to secure that weapon? We had to educate that veteran, educate the providers who are treating that veteran, and educate family members about lethal means and lethal means safety and storage. And what we have found is that if we use that same scenario and went to that individual and said, listen, we understand that you're in a crisis. Can we get you to secure that weapon safely, lock it up, store it, give the key or the lockbox to a trusted family member or friend until you can get through this crisis? And what we found is that that seemed to work better than just taking away the weapon and never getting it back again. And so most of the time, crises are just brief. They're brief episodes, and we can get people through that crisis. And so just by educating them and the providers, it has done wonders in terms of decreasing, weapons out there that are not secured. So most suicidal crises are brief. And so the time for decision to action is usually less than 1 hour. And so you can see there were a couple of studies that were done. When the thoughts were less than 5 minutes, it was 24%. Less than 20 minutes, 48%. And within an hour, 71%. Okay? And so you can see 85 to 90% of firearm injuries are fatal. All other methods combined is 5%. So that's why we had to really push the education on lethal means safety and lethal means safety and storage. And lethal means safety, it does work. So reducing lethal suicide methods is one of the few population interventions that has been shown to decrease suicide rates. And about 90% of people who survive a suicide attempt do not go on to die by suicide. So that's definitely a plus. And so if we collaborate with that veteran at a time to help them survive a crisis, we have likely prevented suicide for the rest of their lives. And that's our ultimate goal, to prevent it. Now, suicide is preventable. So now I want you guys to get ready to type in the box. I'm gonna ask a couple of questions, and I want you guys to type in either false, a true, a myth, or reality. So this is gonna be our common myths and realities about suicide. So first question, people who talk about suicide are just seeking attention. Is that a myth or reality? Come on. I see one myth in there so far. People who talk about suicide are just seeking attention. Myth or reality? Okay, I see one reality in there. Okay. The answer is it's a myth, because no matter how casually or jokingly said, suicide threats should never be ignored, and they may indicate serious suicidal feelings. So someone who talks about suicide provides others with an opportunity to intervene before those behaviors occur. Now, everybody who mentions suicide or says something about suicide doesn't necessarily mean that they have a plan or intent to act on it. However, just by them engaging in that conversation is telling you that there's something going on and they need further attention. So we don't want to ignore what's going on. Okay? Next one. The only one who can really help someone who is suicidal is a mental health counselor or therapist. Is that a myth or reality? The only one who can really help someone who is suicidal is a mental health counselor or therapist. Okay, and that's a myth, because special training is not required to safely raise the subject of suicide. So helping someone feel included and showing genuine heartfelt support can also make a big difference during a challenging time. Sometimes just being a good listener, validate that individual. If you do those two things, you have gone a long way, okay? A long way. Just making that person feel like they're important, letting them express themselves, and just listening to them. Yes, and showing some compassion. Okay? Now I'm going to go over the steps of S.A.V.E. And this is, as I said earlier, this is our entry-level suicide prevention training. So it's called VA C. And so VA S.A.V.E, it teaches communities how to help people at risk for suicide. It will help you act with care and compassion if you encounter someone in a suicidal crisis. You don't have to remember all of these, but this is the easy acronym for us. S, signs of suicidal thinking should be recognized. A, ask the most important question of all. And I'm gonna stop right here. Does anybody know what that most important question of all is? I want you to type it in the box. What is the most important question of all that you should ask someone who's in a suicidal crisis? Go ahead and type it in the box. Okay, I see a few answers in there. Well, I'm not going to give you the answer to that question just yet. V, validate the veteran's experience or the person's experience. E, encourage treatment and expedite getting help. So when we get to A, we're going to see how well you did on answering that question. So S, signs of suicidal thinking. So you want to learn how to recognize these warning signs. Hopelessness. You will see a lot of hopelessness in veterans because veterans are experiencing so much, leaving the service, trying to figure out what they're going to do next. Some dealing with issues that they had during the service, even before the service. You know, sometimes joining the service can bring up issues from your past. So we see a lot of hopelessness and feeling like there's no way out of their situation. But you want to be able to recognize these things. Anxiety. Anybody know what anxiety is? Anxiety is that feeling of nervousness. Something is about to happen, not sure what, not sure when, not sure who. Some people will start to have physical symptoms. Some people will have sweaty palms. Some people will feel nauseous. Some people will have a racing heart rate. Some people actually have a full-blown panic attack, okay? And so, you know, you want to be able to recognize this: agitation, sleeplessness, or mood swings, feeling like there's no reason to live. And you'll see a lot of that, especially when people are overwhelmed with their situation. Rage or anger. You know, we tend to see a lot of rage and anger because rage and anger is a mask usually for other issues, you know. And what we will find is that when you peel back the layers of rage and anger, you will probably find some anxiety. You'll probably find a lot of depression. It's just easier for people to get angry than to deal with those other emotions that are going on. Engaging in risky activities without thinking. And I mean, we've seen a lot of this. If you drive on I-95, I see people on that highway, high rates of speed, motorcycles, no helmets, weaving in and out of traffic. And, you know, you wonder, is this person engaging in risky activities? Okay. So I've seen a lot of that. Also, increasing alcohol and drug use. Remember what I said earlier about alcohol and drugs, mood altering substances. So when you engage in mood altering substances, it usually alters your judgment as well. And then withdrawing from family and friends. So signs of suicidal thinking. You want to, if there's the presence of any of the following signs, you want to make sure that you get this person immediate attention. Thinking about hurting or killing themselves. Looking for ways to die. And believe me, there's 1,000,001 things that you can do to the 10th power. Okay? Self-destructive or risk-taking behavior, especially when it involves alcohol, drugs, and weapons. Now remember, you got a whole bunch of combination of things going on here. Self-destructive behavior, alcohol and drugs, and then weapons. Okay? Not a good combination. And especially if there's underlying mental health issues. Not a good combination, okay? And usually it leads to signs of suicide. Oh, okay, so asking the question, know how to ask that most important question of all. So I was looking in the box, and so let me give you the answer to that. So this is the question that you want to ask. Are you thinking about killing yourself? That's what you want to ask. That's the most important question you want to ask, and that's exactly how you want to ask it. Are you thinking about killing yourself? You don't want to use the term harm. Are you thinking about harming yourself, hurting yourself? You don't want to use that term because harm and hurting yourself can mean different things for different people. You know, I could stub my toe on the end of the table and hurt myself. Someone else might decide that, you know, a gunshot will hurt myself. So it's different things for different people. So we want to be clear. We want to make sure that there's no mistake when we get the answer from this question. So if I say to you, are you thinking about killing yourself? I'm looking for either yes or no answer. There's no gray area. There's no in between. So we want to be able to ask that question that way. Now, asking the question. So there are a couple of do's and don'ts when you're asking the question. So you do want to ask the question if you have identified warning signs or symptoms. You want to go ahead and ask that question. You do want to ask the question in a natural way that it flows with the conversation. So let me give you an example. So let's say John. John is a friend of yours. You work a couple of offices down from each other, a couple of buildings down from each other, and you're going to meet up for lunch. John tells you he's going through a divorce. That's on that list. Relationships. He may lose his house because he may have to turn over the house. Financial, he may have to alter his visitation with his children. Another issue, and he just doesn't know what to do. He's tired of this divorce. And John says to you, you know what? I'm so sick of going back and forth to court. I could just walk right in front of that bus and end it. Now, although John didn't say he wanted to kill himself, and he may not have plans or intent at that moment, but clearly it tells you that he's overwhelmed and he's dealing with all of these issues. There's all the signs that are there. And so this is your opportunity to intervene and get John some help. And if he says to you, I could just walk in front of that bus, you want to go ahead and ask that question. John, you got a lot going on. Are you having thoughts of killing yourself? You want to go ahead and ask him that. And make sure that he's okay and get him to the right resources. But you want to make sure that question is in a natural way that flows with the conversation. Now, we could take John again as an example, and he could just say to you, yeah, this divorce is trying, but I got to give up the house, but the kids have to have somewhere to live, and I want them to be close to their school. I won't be able to visit them every day, but I will get them 2 weekends out of the month. And so John is telling you all these things, but he doesn't appear to be in distress, and he didn't say, I could jump in front of the bus. So that question, if you come out and say, John, are you going to kill yourself? It doesn't really flow in that context, in that conversation. Okay. So you want to make sure that it's natural and it flows with the conversation. You can still offer him resources though. John, if you ever need any help, I got this number over here. You can always call 988. And don't wait to ask the question don't ask the question as if you're looking for a no answer. So if you're looking for a no answer, you always put no in the question. So if you ask John this way, if you say to John, you aren't thinking of killing yourself. If you say to John, you aren't thinking of killing yourself, you've already told him he's not going to kill himself. So there's no way that he's going to answer you honestly because you've already answered for him. So you have to leave the question where he answers the question. Okay. So if you say, John, are you thinking about killing yourself? That gives him the ability to tell you honestly, yes or no. But if I say you aren't, I've already answered the question for him. A prime example is my daughter, and the team has heard this many times, but she loves these shoes called Crocs, Crocs. I don't like the shoes. I don't think they have any place in society. Maybe they belong on the beach. I don't know. People love them. I don't think they're made for walking. But every opportunity she gets, she wants to put those shoes on. And I try to explain to her, the shoes, they have no back. It can come off your feet if you have to run. Every day she wants to put on those shoes. So this is my question to her. When, I don't want her to wear those shoes. I would say to her, Nicole, you're not wearing those shoes, are you? So if I say you're not wearing those shoes, that's not a question. I basically have told her you're not wearing those shoes. I just added the "are you" at the end, but that I really have told her you're not wearing those shoes. If I wanted her to give me an honest answer, I would say, Nicole, what shoes do you want to wear today? Then she could tell me whatever shoes she wants to wear. But if I say you're not wearing those shoes today, are you? I basically have said you no. So you want to give them the opportunity to answer honestly. And don't wait to ask the question when someone is halfway out the door. Like John, if you just had lunch with him and he shared all that with you before you sat down at the restaurant, and now your lunch is done and you're ready to go back to your office, You want to ask him now? You had a whole hour to ask him. You could have intervened right there. So you want to make sure that you ask the question early and get them the help and the resources as soon as possible. V, validate that person's experience. I cannot tell you how important this is. When you validate someone, you make them know that their opinion matters, they matter, and that they're important. And so you want to be able to do that. Talk openly about suicide, be willing to listen, and that's the key, be willing to listen and allow that person to express their feelings. Recognize that the situation is serious, but don't pass judgment. Because people, human beings, we can pick up really quickly when someone's passing judgment on us, really quickly. And it'll be a big turnoff and you'll lose that person. So don't pass judgment. Reassure them that help is available because help is available. Encourage treatment and expedite getting help. So what should you do if you think someone is suicidal? You don't want to keep it a secret. This is not the type of secret that you want to keep. You want to get that person help. And I know sometimes people can say, if you say something, I'm never going to speak to you again. Well, you know what? If it's someone I love and care about, and even if it's not, I'm going to say something because I'm going to save their life. They'll come back and thank me later. So don't keep it a secret. Don't leave that person alone. And believe me, just because the room looks empty, it doesn't mean it's empty. People can find all kinds of things in rooms. So don't leave that individual alone. Try to get that person to seek immediate help from his own doctor or the nearest emergency room. Call 911. Reassure them that help is available. Call the Veterans Crisis Line, which is 988 now. Instead of the 10-digit number, you can just dial 988, sort of like you dial 911. If it's a veteran, you press number 1, they'll get connected to a veteran respondent. If you just dial 988, it'll go to the National Suicide Prevention Lifeline. Same thing, a respondent will answer. So when talking with a person at risk for suicide, first thing you want to do is remain calm. You want to listen more than you speak. Sometimes people just need to vent. Allow them to do that, okay? Uninterrupted. Maintain good eye contact. Act with confidence. You may not know everything to do, but you want to at least give off that you know what to do. Don't argue with that individual. Leave all those controversial topics alone. Don't go there because everybody has their heels dug in, nobody's budging. So it's a no-win. Okay, politics, religion, abortion, all those things, don't go there. Use open body language. Don't be like Macaulay Culkin on Home Alone with the shock face, okay? Limit your questions. Let that individual do the talking. Use supportive and encouraging comments. Be honest and let that person know that there's no quick solution, but help is available, okay? And I think they would appreciate that more than just telling them a whole pack of lies. Oh yeah, we can do all of this, be honest. So what do you do if someone expresses suicidal ideation during a phone call? You want to keep that person on the line. Don't hang up or transfer the call. I work in an office one day a week, most of the time at home. And even when I'm in the office and when we were in the office full time, I just never transferred enough calls to be good at it. So I'm the last person you want to transfer a call. And believe me, if you're not good at transferring calls, this is one you definitely should not transfer. I know for myself, by the time I figure out, should I press the star or the pound button, by that time I've disconnected the caller. So don't transfer the call. Leave that up to your call centers and your operators. Remain calm. Try to get as much identifying information on the caller as possible, their name, their phone number, their current location. Even if they go by a nickname, you just want to get as much information as you can. You'd be surprised who can be identified by their nicknames, okay? You want a conference call to the Veterans Crisis Line. This is if you know how to do it, and for those skilled people who transfer calls, and they can transfer that call and a conference call and wait until the responder picks up the call. But unless you really know how to do that, I would stay away from that. Get your coworkers to help you. You can use instant messaging on Teams. If you have a cell phone, you may just have to start texting for help. If you're on the phone, And you can still text and talk at the same time, believe me. And if the caller disconnects, call them back. If no answer, then you want to go ahead and dial 911. Let them know that you were on the phone with someone and you got disconnected and you were concerned and you want them to do a welfare check. Then after that, you can go ahead and call the Veterans Crisis Line at 988, explain to them the same thing that you just explained to the 911 operator, and they will follow up as well. Okay. And if you need to, you can practice conferencing calls at your desk with coworkers, but I would really keep that for our call center people. That's just what they do on a regular basis. And so that was our VA SAVE training, our one-on-one suicide prevention. And now I'm just going to give some quick resources, and hopefully we'll have a couple of minutes for questions. So I think we went over that one. So our resources. So the Veterans Crisis Line, as I mentioned earlier, it has gone from the 10-digit number, the 1-800-273-8255 to 988. And this is great because it would alleviate people from having to remember a 10-digit number. It operates just like 911. So you press 988. And if you're a veteran or active duty service member, you just press number 1. If it's just civilian, just hold the line and a responder will pick up. So anyone can call this line, veterans, active duty service members, family members, friends. You can even call anonymous. The crisis line is open 24 hours a day, 7 days a week, 365 days a year. And there's actually 3 call centers, one in Atlanta, Georgia, one in Canandaigua, New York, and one in Topeka, Kansas. And the crisis line actually opened up in 2007. And since then, we've had over 6 million phone calls, almost 7 million calls. And this data was as of February of 2023. So we may be breaching 7 million by now. Over 800,000 chats, 299,000 texts, over 1 million referrals, and over 200,000 dispatches of emergency services. And each VA medical center has what we call a suicide prevention coordinator, and they're the ones that get the referrals from the Veterans Crisis Line. And if someone calls the crisis line, and if they're not in immediate danger, they will be referred to a suicide prevention coordinator closest to them, wherever they live, whatever city or state. And that suicide prevention coordinator has 24 hours to reach out to that individual. If it's an emergency case, emergency services will be dispatched immediately, and the suicide prevention coordinator will still get a referral. And so this is our crisis line, our resource locator. You can go on that webpage and get the resources and find the local suicide prevention coordinator. Making a connection. This is an online resource where you have several vignettes where you have veterans talking about their struggles with mental health and suicide and how they recovered and how they got into treatment and actually have recovered from that. So those are good vignettes to take a look at, real veterans. Practice safe storage of firearms, medications, and other lethal means, keepitsecure.net. So this is one of the campaigns that the VA has been using, and just educating the public as well as the veterans. This is our lethal means safety resources. And as I said earlier, educating not only the veteran, but the providers who treat veterans and their family members. Because we have providers who, some who have never handled weapons and don't really know what it means to own a weapon, things like that. So in order to treat someone who has a weapon, you should be familiar with these things. And so that's why the VA has beefed up this training and education. And then these are some extras, mental health mobile apps. They're all free. You can take a look at those. The only thing we just encourage people to use the apps along with their mental health counselor. It's not just a one, you use an app and you're cured, but it's to augment your treatment. And so we encourage you to use it along with your therapist. PTSD Coach, which has a safety plan. If you don't know what a safety plan is, there's a written source of resources that you can use during a crisis. Many of our mental health patients have them. Now they can have them on their phone. And I just had the opportunity to assist with the development of it. So this is a great app, great app. Coaching in the care. So if you are a spouse or a family member of a veteran or service member, and they're reluctant to receive services, you can call Coaching in the Care, and they'll help you in terms of how to get that veteran to seek support, and they may even speak to that veteran themselves. LGBTQ, as we know, all those who have served, they deserve resources as well. So we have coordinators who have information for LGBTQ community and resources, patient care services. And so that's here on these links. Postvention resources. We don't talk about postvention a lot, but tragedies do happen and our communities have to be prepared. And so these are free resources that the VA offers to help aid providers, communities, and the workplace when these types of things happen. In our VA SAVE training, what we just went through, you can actually take this training online through Psych Armor Institute, which is one of our VA partners. It's 25 minutes and it's free. All you have to do is just register on the website. And we just encourage anybody who wants to have suicide prevention training to go ahead and take the training. And that's it. And I'm turning it back over to Ms. Pauling for any questions and answers.
Thank you so much, Ms. Mells, for that presentation and that wealth of information. We really appreciate that. Now we're going to address questions in the Q&A box to the right of your screen. I will read the questions out loud and Mrs. Mel will provide a response. If we are unable to get around to your questions today, we will take your questions down and get a response back to you soon. We have your email addresses. Okay, we have a few questions in the Q&A box and we'll read them out loud for the folks that called in. Our first question came from Miss Nora Watts. She wants to know, she made a comment actually and asking a question. It's difficult to sit with someone in so much pain. Do you have any suggestions to help providers like me trying to do a difficult task? Thank you.
She said providers, I'm sorry.
Yes, she said providers like me. So she's a provider.
So I would definitely talk to the folks in the pain clinic. They have come up with some new resources and treatment plans. So definitely talk with someone in the pain clinic. And I believe they have psychologists over there as well.
Thank you. Second question is coming from Diana. Why don't you talk more about suicide postvention? I had a veteran buddy who committed suicide, and when I found out about it, it was during COVID when everyone was social distancing, which was caused by depression and PTSD to be really bad. It was a time when I really needed that extra information about the postvention part of suicide prevention / postvention.
Well, it's interesting. I just gave that a postvention resource, but I will also put in a plug that the Center for Faith-Based has actually had a webinar on postvention. You could probably go on our website and take a look at some of the webinars that we've had and look for the postvention one. But we've had several of those on, I want to say, in the past few months.
Okay.
And then use the resource that was listed in the slides.
Okay. If you need to reach out to our presenter, Ms. Mells, her point of contact information is on the screen right now. You can also reach out to our team here at Center for Faith-Based and Neighborhood Partnership and get our team information as well. You also see our website where we have our recorded webinars. That is where the postvention webinar is to answer the last question, and also our Facebook page as well.
And true, I would just say if they want to reach out to me, it's better to do it through the CFBNP.
Okay, thank you. At this time, I'm going to turn the mic back over to Mr. Washington. We don't have any more questions. Mr. Washington? I'm sorry, Mr. Washington had to leave the meeting. I apologize for that. We do have like I mentioned before, we have webinars that are coming up. And our next webinar will be on August the 16th with the Office of Rural Engagement. They will give an overview of their programs. And that will be August the 16th from 2 to 3 o'clock. We hope you all can join us on that webinar, and that is next week. And for now, if you register for this event, we will provide you with today's handout, the resources, the link to the handouts, the link to the resources. A recording of this webinar will be provided on our website at a later date.
Not this recording. But
I'm sorry. A recording will not be provided of this particular webinar because it has to be updated periodically, often, so the information is updated and good information to provide. But please subscribe to our website and Facebook for future webinars and information. This adjourns today's webinar. Thank you so much for joining us today, and goodbye and have a safe and wonderful day. Bye-bye. Thank you.
and thanks again for having me.
Thank you, Lillie.